By allowing Missourians to opt out of this federal mandate to that they must carry health insurance, aren't you just forcing the rest of us who have health insurance to pay more? Because those people who choose not to buy health insurance are technically still covered, and they're covered by the people who actually pay for their health insurance.
You know, the way this shoddy legislation was written, I think that people are going to figure it out. They're going to game the system. They can not buy health insurance, pay the small fine, and then when they get sick, they can't be refused health insurance. So this isn't going to fix anything. Anything where the federal government gets involved, it is more costly, and they just don't work. I mean, look at the examples we have. You go back to Social Security and Medicare. We've got $55 trillion of unfunded liability there. The federal government makes a boondoggle of just about everything that it does, and that's why our founders wanted their power to be limited. They wanted government to be close to the people. These are things the state should be doing, and quite frankly, Missouri has done it, McGraw, in the past. The last 5 years, we've set up a network of federally qualified health care centers across this state where any Missourian can access their health care if they're not covered or if they do have insurance.
Exactly.
So we are addressing it.
Exactly my point. I don't want to pay for people who choose not to have health insurance. I don't want to pay for people who choose not to have car insurance either. But I would like to see where if you don't have health insurance, you are denied health coverage. It's as simple as that. Why can't we have a law like that?
Okay, well, let's repeal EMTALA then, where the federal government passed a law that forces hospitals in Missouri and across the country to take patients and not be able to refuse care. And again, across the state of Missouri, we're opening healthcare clinics actually across the street from emergency rooms with that purpose, so that people can access their care in a place that isn't the most expensive, and the cost shift doesn't go to the rest of the taxpayers.
Would you be in favor of opting out of that federal legislation that says we don't have to cover people who have health insurance?
Certainly.
You would be?